Hi, I'm Dr. Maeghan here with Northwest Integrated Medicine, and today I'm going to give you just a brief update on some of the things we've been learning about the COVID-19 virus in this ongoing pandemic. As the research has continued and the cases have mounted, we've learned how this affects our bodies, how it's spread, and how we can work to prevent further spread of this virus. One of the most important things that I've really noticed is the transition of what we think the main symptoms of COVID-19 are. So when we first started, it was all about the fever. Do you have a temperature increase? Are you experiencing a cough or a cold-like symptom, sinus congestion? As things have progressed, we've really learned that in the earliest stages of this disease, it's most often not these kind of congestive symptoms that we're seeing. It's most often headaches, muscle aches, and a sense of fatigue. Now, that's a hard one to distinguish because if you're like me, I feel tired on a fairly regular basis and I have a history of headaches, so it's kind of hard to tell when those things are kicking in. From reports, it sounds like it's going to be more extreme than what you're used to if it's something that you already deal with. For instance, headaches have been described as the worst headaches of my life. So if you're experiencing a big change in those symptoms, just use a little extra caution and perhaps reach out to your primary care provider. One of the other things that I found most important when I was doing research was that this virus spreads before we're symptomatic. Now, thankfully, when we first started, we were saying 2 weeks beforehand. Now, that really comes from the fact that from the time you're exposed to a virus until you can maybe present with those initial symptoms that I was just discussing can take up to 14 days. Usually it's around the 5-day mark, but it can take up to 14 days, which is why that quarantine period that they're encouraging if you have been exposed is 14 days. The reason why we isolate even if you don't have symptoms is because in the 2 days prior to when you have any symptoms, you are most likely to be throwing off virus. So that means that before you have any reasonable idea that you're sick, you could be out there sharing germs. Now, I'm a big fan of sharing, but germs are one of those things we don't want to be sharing, especially with people who have immunocompromised, who are elder, who have low vitamin D status, people who are at higher risk. So that is one of the reasons why this is such a tricky bug to track, is because people don't know that they're sick and they're spreading this virus. So, what happens if there's an exposure? That's something else we're really learning about. If there's an exposure, when a contact tracer calls you or someone who's, had an exposure is contacting you, it means that they think that they have had at least 15 minutes in a 24-hour period where they were within 6 feet of you. And that's in the 48 hours before they have symptoms through when they go into their isolation and quarantine. If you're exposed during that time period, you are asked to go into your own 14-day quarantine. This can be really hard on some of us. For instance, at our clinic, if a provider gets exposed, that means 2 weeks of not being able to come into the clinic. We take this very seriously, and if there is an exposure, our providers are asked to go home and work from home. If they're not symptomatic, they're going to continue to do telehealth medicines and be available for patients. We have a lot of systems in play to make sure that you still have access to the type of care that you need, but we ask that you're a little more flexible with seeing different providers for in-office procedures and for going into telehealth visits. That's only because we don't want to spread any germs and get you sick. We take it very seriously. The other thing that we've really seen is that we don't always think about how we are a vector. And COVID is the most important thing going on right now, but it's surely not the only thing going on right now. One of the things that we've had is parents who are just totally exhausted and coming in for their appointment and unfortunately bringing in sick kiddos. So if you have a kiddo who's sick, we ask that you don't bring them into the clinic with you during your visit, especially not without letting us know, because we need to be able to prevent the spread of that virus, whether it's RSV or croup or the flu or the common cold. We don't want those bugs getting spread either. So if you have any of those symptoms, be sure to touch base with our clinic. Calling us, emailing us will help you triage and figure out how to get the care you need without spreading those bugs. I've written a pretty good blog that goes through all of this in detail, talks about how we're working to prevent the spread of COVID-19 in our clinic, We take this very seriously. I also put together some tips for you on how to take care of yourself. Of course, if you have any need of healthcare, we're here for you. We are available. We're seeing patients. We even see patients with COVID. We just see them via telehealth, and we do swabs in the parking lot to keep everybody safe. So go in peace, go in happiness, have a happy Thanksgiving or whatever you're going to celebrate during this time. We're sending you just all of our hope for a healthy, happy holiday season. Thank you.